Question 1. Health information management and medical records. A medical administrative assistant is responsible for ensuring compliance with the Health Insurance Portability and Accountability Act (HIPAA) when handling patient records. A patient calls the office and requests that their medical records be sent to a specialist for further treatment. Which of the following actions should the assistant take to ensure compliance with HIPAA regulations? A. Send the records immediately to the specialist without additional documentation, as it is part of continuity of care. B. Ask the patient for verbal consent over the phone and send the records as soon as possible. C. Require the patient to complete and sign a HIPAA-compliant authorization form before releasing the records. D. Decline the request and inform the patient that medical records cannot be shared under any circumstances. Answer. C. Require the patient to complete and sign a HIPAA-compliant authorization form before releasing the records. Explanation. Under HIPAA's privacy rule, healthcare providers must obtain written patient authorization before releasing protected health information unless it is for treatment, payment, or healthcare operations. In this scenario, although the records are being sent for treatment purposes, most healthcare providers still require authorization to document patient consent. Option A is incorrect because although sharing records for continuity of care is permissible under HIPAA, best practice requires written authorization to prevent unauthorized disclosure. Option B is incorrect because verbal consent is not considered legally binding authorization under HIPAA regulations. Option D is incorrect because medical records can be shared with patient authorization or in certain legally permitted situations. Relevant regulation. HIPAA Privacy Rule 45 CFR 164.508. Question 2. Insurance processing and billing procedures. A patient with a high deductible health HSP visits the clinic for a routine checkup. The total cost of the visit is $200 and the patient's deductible has not yet been met. The insurance claim is processed and the explanation of benefits EOB indicates that the patient is responsible for the full $200. What should the medical administrative assistant do next? A. Bill the patient for the full $200 since their deductible has not been met. B. Write off the charge since the patient has insurance and the claim was processed. C. Submit an appeal to the insurance company requesting coverage. D. Bill the patient only for the copayment, as the deductible does not apply to routine visits. Answer. A. Bill the patient for the full $200 since their deductible has not been met. Explanation. A high deductible health AHP requires patients to pay all medical expenses out of pocket until they reach their deductible. Since the patient's deductible has not been met, the insurance company will not cover the visit and the patient is responsible for the full amount. Option B is incorrect because writing off the charge without justification is considered improper billing and could be seen as insurance fraud. Option C is incorrect because there is no basis for an appeal when the EOB correctly states that the patient is responsible for the payment. Option D is incorrect if HPs typically require patients to pay for routine visits until they reach their deductible. Relevant guidelines EORLs, explanation of benefits EOB processing guidelines, CMS billing regulations. Question 3. Scenario-based. Medical office compliance and risk management. Sarah, a medical administrative assistant at a busy clinic, notices that Dr. Williams routinely leaves patient charts open on his desk when stepping out of his office. She also sees that another staff member is discussing a patient's medical condition loudly at the front desk where other patients can hear. Sarah is aware that both of these actions could be HIPAA violations. What is the best course of action for Sarah to take? A. Immediately report both incidents to the Department of Health and Human Service (HHS) for HIPAA violation. B. Politely remind Dr. Williams and the staff member about HIPAA's requirements for safeguarding patient information and, if the issue persists, report it to the office's compliance officer. C. Ignore the incidents as it is not her responsibility to enforce HIPAA regulations. D. Confront the staff member and Dr. Williams in front of patients to ensure compliance. Answer. B. Politely remind Dr. Williams and the staff member about HIPAA's requirements for safeguarding patient information and, if the issue persists, report it to the office's compliance officer. Explanation. Medical administrative assistants play a crucial role in ensuring compliance with HIPAA regulations. The best approach is to first address the issue directly in a professional and respectful manner. If the issue persists, it should be reported to the compliance officer for further action. Option A is incorrect because reporting directly to the Department of Health and Human Service (HS) should be last resort after internal office procedures have been followed. Option C is incorrect because ignoring HIPAA violation could lead to legal and financial consequences for the clinic. Option D is incorrect because confronting colleagues in front of patients is unprofessional and could escalate the situation. Relevant regulation, HIPAA security and privacy rules, 45 CFR Parts 160 and 164. Question 4. Topic: Health Information Management and Medical Records. A medical administrative assistant is responsible for ensuring that patient records are properly documented and securely stored in accordance with HIPAA regulations. A patient, Mrs. Rodriguez, has requested access to her medical records. She states that she needs them for a consultation with a specialist. However, the physician in the office is concerned about releasing certain mental health notes contained within the record. What is the most appropriate course of action for the assistant to take? A. Deny the request entirely because mental health records are protected under federal law. B. Release all records, including mental health notes, since the patient has the right to access her entire medical history. C. Provide the records, but exclude the mental health notes if the physician determines that access to them could be harmful to the patient. D. Inform Mrs. Rodriguez that she needs a subpoena before she can obtain any of her medical records. Answer: C. Provide the records, but exclude the mental health notes if the physician determines that access to them could be harmful to the patient. Explanation: under the HIPAA Privacy Rule 45 CRS 164.524, patients generally have the right to access their medical records. However, there are exceptions, particularly concerning mental health records. If healthcare provider determines that releasing certain mental records could cause harm to the patient, those records can be withheld or summarized instead of being fully disclosed. The provider must document the reason for withholding the information. Option is incorrect because not all mental health records are automatically protected from patient access. Only those deemed potentially harmful by the provider. Option B is incorrect because there are legal exceptions where full access is not granted. Option D is incorrect because subpoena is not necessary for patient to access their own medical records. A written request is generally sufficient. Question 5. Topic: Medical Office Compliance and Risk Management. A healthcare administrator notices that the electronic health record (EHR) system has been experiencing frequent cyber attacks due to weak security protocols. After investigating, the administrator finds that some employees have been using easily guessed passwords and others have been sharing login credentials to access patient records. What is the most appropriate step for the medical office to take to improve cybersecurity and comply with HIPAA requirements? A. Implement a multi-factor authentication (MFA) system and conduct staff training on password security. B. Continue using the current system but require employees to change their passwords every 6 months. C. Restrict access to patient records only to the department to limit unauthorized use. D. Allow employees to share credentials only if they work on the same team and require immediate access to records. Answer A. Implement a multi-factor authentication (MFA) system and conduct staff training on password security. Explanation: under the HIPAA Security Rule 45 CFR S 164.312, covered entities must implement administrative, physical, and technical safeguards to protect electronic protected health information (FI) from cyber threats. Multi-factor authentication (MFA) is one of the practices recommended by the Department of Health and Human Service (HHS) to prevent unauthorized access to medical records. Option B is incorrect because merely changing passwords every 6 months does not address the root security issues. Strong passwords and MFA are more effective. Option C is incorrect because restricting all access to its staff would severely impact the efficiency of medical staff who need patient information to provide care. Option D is incorrect because credential sharing is direct violation of HIPAA and significantly increases the risk of data breaches. Question 6. Scenario-based. Topic: Patient relations and customer service. Mr. Carter, a 65-year-old Medicare patient, arrives at a busy medical office for his routine checkup. Upon check-in, he appears visibly frustrated and tells the receptionist, "I've been waiting on the phone for over an hour to reschedule this appointment and no one ever called me back." He further complains that the front desk staff has been rude and unhelpful during past visits. As the medical administrative assistant, how should you professionally handle the situation while ensuring compliance with patient satisfaction standards? A. Apologize for the inconvenience, escalate the issue to the office manager, and offer to assist Mr. Carter with future scheduling concerns. B. Tell Mr. Carter that the office is very busy and that long wait times are normal for patients with Medicare. C. Inform Mr. Carter that he should have called during non-peak hours to receive better service. D. Ignore Mr. Carter's complaints and proceed with the check-in process as quickly as possible to avoid illic. Answer A. Apologize for the inconvenience, escalate the issue to the office manager, and offer to assist Mr. Carter with future scheduling concerns. Explanation. Providing exceptional customer service in a medical setting is essential for patient satisfaction and retention. According to the Centers for Medicare and Medicaid Services (CMS), patient experience and engagement are critical metrics for evaluating healthcare providers. The best approach is to acknowledge the patient's frustration, show empathy, and take immediate steps to resolve the concern. Option B is incorrect because dismissing the complaint and attributing long wait times to Medicare patients could be perceived as discrimination. Option C is incorrect because blaming the patient for calling at the wrong time is unprofessional and does not address the core issue of inadequate customer service. Option D is incorrect because ignoring the complaint will only escalate the patient's frustration and may result in formal grievance. Best practice. Medical administrative assistants should implement effective communication techniques, such as active listening and de-escalation strategies to improve patient interactions and uphold professional standards. Question 7. Topic: Insurance processing and billing procedures. A medical administrative assistant is reviewing a Medicare explanation of benefits (EOB) for a patient who was recently seen for a wellness visit. The EOB states that the claim was denied because the service was not medically necessary under Medicare guidelines. What is the best course of action to address this issue? A. Resubmit the claim immediately without any changes and hope for a different result. B. Inform the patient that they must pay the full amount out of pocket since Medicare denied the claim. C. Review the documentation and, if necessary, submit an appeal with supporting medical necessity documentation. D. Advise the patient to contact Medicare directly because the office has no control over denied claims. Answer. C. Review the documentation and, if necessary, submit an appeal with supporting medical necessity documentation. Explanation. Under Medicare guidelines, CMS regulations, claims may be denied if a service is not deemed medically necessary. However, if the denial was due to a documentation error or lack of proper justification, the provider can submit an appeal with supporting medical records. Option is incorrect because simply resubmitting the claim without addressing the reason for denial will likely result in another rejection. Option B is incorrect because Medicare beneficiaries should not be required to pay unless proper steps have been taken to appeal or verify coverage limitations. Option D is incorrect because the medical office does have a responsibility to assist the patient in understanding claim denials and the appeal process. Appeal process. Request a redetermination first level appeal include medical documentation justifying medical necessity. Submit within 120 days of the EOB denial. By following these steps, the claim may be reconsidered and potentially paid by Medicare. Question 8. Topic: Medical ethics and legal responsibilities. A medical administrative assistant receives a request from an attorney for a patient's medical records related to recent workplace injury claim. The attorney states that the patient has given verbal consent for the release of records but has not provided signed authorization. What is the most appropriate action for the assistant to take? A. Release the records immediately since the attorney represents the patient. B. Deny the request and require the attorney to obtain court order before releasing any records. C. Request signed HIPAA-compliant authorization form before disclosing any patient information. D. Contact the patient's employer to confirm the necessity of the records before proceeding. Answer. C. Request a signed HIPAA-compliant authorization form before disclosing any patient information. Explanation. Under the HIPAA Privacy Rule 45 CRS 164.508, patients' written authorization is required before releasing their protected health information, FI, unless it falls under exceptions such as treatment, payment, or healthcare operations. Verbal consent is not sufficient for medical records to an attorney. Option is incorrect because an attorney's request alone does not override HIPAA protections. Option B is incorrect because court order is not required if the patient provides written authorization. Option D is incorrect because an employer cannot access an employee's medical records without the employee's explicit consent. Best practice: always verify the authenticity of authorization forms before releasing patient information. Question 9. Scenario-based. Topic: patient confidentiality in HIPAA compliance. A pharmaceutical sales representative arrives at the clinic and asks to review patient charts to determine which patients may benefit from a new medication. The representative claims that they are working directly with the physician to identify eligible patients. How should the medical administrative assistant respond? A. Allow the sales representative to access patient records as long as they are accompanied by a physician. B. Refuse the request and explain that access to patient records is restricted under HIPAA regulations. C. Provide the representative with a list of patients who may qualify but exclude their specific diagnoses. D. Check with the clinic's compliance officer before deciding whether to release the information. Answer: B. Refuse the request and explain that access to patient records is restricted under HIPAA regulations. Explanation: HIPAA strictly prohibits the unauthorized disclosure of patient health information. Pharmaceutical sales representatives do not have a legitimate reason to access medical records because they are not involved in treatment, payment, or healthcare operations. Option A is incorrect because even if the physician supports the request, it would still violate HIPAA. Option C is incorrect because even a partial disclosure, e.g., listing names, violates patient privacy. Option D is incorrect because HIPAA guidelines already make it clear that such access is not permitted. Best practice: always deny third-party access to patient records unless proper patient consent is obtained. Question 10. Topic: scheduling and patient flow management. A busy family practice clinic is experiencing long patient wait times due to overbooked appointments. Patients are frustrated and some have left the clinic without being seen. As a medical administrative assistant, what strategy should be implemented to improve patient flow and reduce wait times? A. Implement a time blocking system and schedule buffer time between appointments. B. Schedule all patients back to back to maximize efficiency. C. Instruct providers to spend no more than 10 minutes per patient. D. Double book appointments during peak hours to reduce no-shows. Answer A. Implement a time blocking system and schedule buffer time between appointments. Explanation: effective scheduling strategies include time blocking and buffer periods to accommodate unexpected delays, urgent cases, and complex visits. Option B is incorrect because back-to-back scheduling does not allow flexibility for delays. Option C is incorrect because limiting providers to 10-minute visits may compromise patient care. Option D is incorrect because double booking often leads to longer wait times and patient dissatisfaction. Best practice: monitor no-show rates to just scheduling based on appointment type and use automated reminders to improve efficiency. Question 11. Scenario-based. Topic: insurance verification and pre-authorization. A patient with a new health insurance plan arrives for an appointment, but the system indicates that their coverage cannot be verified. The patient insists that their insurance is active and requests to be seen immediately. What is the most appropriate action for the medical administrative assistant to take? A. Allow the patient to be seen and bill the insurance later. B. Ask the patient to pay out of pocket and seek reimbursement from their insurance. C. Call the insurance provider to verify coverage and obtain necessary authorizations. D. Deny service until the patient provides proof of active insurance. Answer: C. Call the insurance provider to verify coverage and obtain necessary authorizations. Explanation: before providing non-emergency services, the office must verify active coverage and obtain any necessary pre-authorizations. Option is incorrect because unverified claims may be denied, leading to financial loss. Option B is incorrect because requiring immediate out-of-pocket payment may be unfair if insurance is valid. Option D is incorrect because outright denying care without verifying the situation could be unethical. Best practice: maintain an updated insurance verification protocol to avoid billing issues. Question 12. Topic: medical billing and coding errors. A medical administrative assistant reviews a claim that was denied due to an incorrect procedure code. What is the appropriate step to correct the claim and ensure payment? A. Resubmit the claim with the same code and hope for approval. B. Edit the claim, correct the procedure code, and resubmit it. C. Ask the patient to call their insurance company and dispute the claim. D. Write off the claim as a loss and do not pursue reimbursement. Answer: B. Edit the claim, correct the procedure code, and resubmit it. Explanation. Billing errors, especially incorrect CPT or ICD-10 codes, must be corrected before resubmission. Option is incorrect because resubmitting an incorrect claim will result in another denial. Option C is incorrect because the provider, not the patient, is responsible for coding corrections. Option D is incorrect because the claim can still be paid if properly corrected and resubmitted. Best practice: use claims management software to flag potential coding errors before submission. Question 13, scenario-based. Topic: handling patient emergencies. In a medical office, a patient waiting in the lobby suddenly clutches their chest and appears to be having difficulty breathing. What is the most immediate action the medical administrative assistant should take? A. Call 911 and notify a medical provider immediately. B. Tell the patient to relax and take deep breaths. C. Ask the patient to fill out emergency contact information first. D. Move the patient to an exam room and continue with routine check-in procedures. Answer A. Call 911 and notify a medical provider immediately. Explanation. A potential cardiac emergency requires immediate medical intervention. Option B is incorrect because delaying medical care can be life-threatening. Option C is incorrect because administrative paperwork is not a priority in an emergency. Option D is incorrect because delaying emergency medical attention increases risk. Best practice: medical offices should have an emergency response plan and train staff to handle urgent situations. Question 14, topic: medical records management and documentation standards. A medical administrative assistant is tasked with organizing electronic health records to ensure compliance with legal and ethical standards. During a routine audit, they discover that a physician has been documenting patient encounters after seeing multiple patients, often hours later. What should the assistant do? A. Notify the physician that delayed documentation may compromise accuracy and compliance. B. Ignore the issue since the physician has the right to update records at their convenience. C. Manually enter information for the physician to keep the records up to date. D. Delete older documentation to prevent inconsistencies in patient records. Answer A. Notify the physician that delayed documentation may compromise accuracy and compliance. Explanation. Accurate and timely documentation is critical for patient safety, legal compliance, and quality of care. According to the Health Information Portability and Accountability Act, HIPAA, and the Joint Khmer Agency guidelines, patient encounters should be documented as soon as possible after care is provided. Option B is incorrect because delaying documentation increases the risk of errors and liability. Option C is incorrect because only licensed providers can document clinical information. Option D is incorrect because altering or deleting records violates compliance regulations. Best practice: encourage providers to use real-time documentation and AI templates to improve efficiency. Question 15, scenario-based. Topic: appointment scheduling and patient flow. A specialty clinic has been experiencing a high rate of no-shows, leading to wasted appointment slots and financial losses. The clinic administrator asks the medical administrative assistant for solutions to improve patient attendance. What strategy should the assistant suggest? A. Implement an automated reminder system via text, phone, or email. B. Overbook appointments to account for expected no-shows. C. Charge a high cancellation fee to discourage last-minute cancellations. D. Require all patients to confirm their appointments 48 hours in advance. Answer A. Implement an automated reminder system via text, phone, or email. Explanation. Automated reminders have been proven to reduce no-show rates by increasing patient engagement and accountability. Option B is incorrect because overbooking can lead to longer wait times and patient dissatisfaction. Option C is incorrect because excessive cancellation fees may discourage patients from booking appointments. Option D is incorrect because requiring confirmations may not be feasible for all patients. Best practice: use a multi-channel reminder system and consider offering online scheduling for flexibility. Question 16, topic: insurance and claims processing. A patient calls the clinic after receiving a denial letter from their insurance provider stating that a recent procedure was deemed not medically necessary. The patient insists the procedure was essential. What is the best course of action for the medical administrative assistant? A. Advise the patient to file an appeal with their insurance company. B. Resubmit the claim with the same coding and hope for approval. C. Inform the patient that denied claims cannot be reversed. D. Tell the patient they must pay the full cost of the procedure out of pocket. Answer A. Advise the patient to file an appeal with their insurance company. Explanation. Insurance companies allow patients and providers to appeal claim denials, especially if there is supporting medical documentation proving the procedure was medically necessary. Option B is incorrect because resubmitting the same claim without additional justification will likely lead to another denial. Option C is incorrect because denials can be appealed under the Patient Protection and Affordable Care Act account. Option D is incorrect because out-of-pocket payment should be a last resort. Best practice: work with the provider to submit additional documentation supporting medical necessity. Question 17, scenario-based. Topic: patient rights and confidentiality. A patient's spouse calls the clinic and asks for details about their partner's recent test results. The spouse states that they always handle the patient's medical affairs and need the information immediately. What should the medical administrative assistant do? A. Decline the request unless the patient has signed HIPAA authorization form allowing disclosure. B. Provide the information since spouses are automatically authorized to receive medical records. C. Tell the spouse to contact the physician directly for the results. D. Email the test results to the spouse since they are a close family member. Answer A. Decline the request unless the patient has signed a HIPAA authorization form allowing disclosure. Explanation. Under HIPAA, Health Insurance Portability and Accountability Act, patient records cannot be disclosed to family members without explicit patient consent unless the patient is legally incapacitated or under a designated power of attorney. Option B is incorrect because spouses are not automatically granted access to medical records. Option C is incorrect because physicians must also follow HIPAA regulations. Option D is incorrect because sending medical records via email without authorization violates HIPAA. Best practice: ensure all staff follow a strict verification protocol for patient information requests. Question 18, topic: handling difficult patients and conflict resolution. A patient becomes upset after learning that their insurance will not cover a certain procedure. They begin shouting at the front desk and demanding immediate action. How should the medical administrative assistant handle the situation? A. Remain calm, listen actively, and offer to explain alternative options. B. Call security immediately and have the patient removed from the premises. C. Ignore the patient until they calm down and are willing to listen. D. Tell the patient that they need to speak with their insurance company directly. Answer A. Remain calm, listen actively, and offer to explain alternative options. Explanation. Handling angry or frustrated patients requires patience, active listening, and professionalism. A calm approach can de-escalate the situation and guide the patient toward a solution. Option B is incorrect because calling security should be a last resort unless the patient becomes physically threatening. Option C is incorrect because ignoring a patient's frustration can escalate tensions. Option D is incorrect because simply deflecting responsibility does not resolve the issue. Best practice: train staff in de-escalation techniques and maintain professional demeanor at all times. Question 19, scenario-based. Topic: workplace safety and OSHA compliance. A medical administrative assistant notices that a sharps disposal container is overflowing in an exam room. What should they do? A. Immediately report the issue and request a replacement container. B. Ignore it and assume that clinical staff will handle it. C. Attempt to push the sharps down further to create more space. D. Empty the container into the regular trash and replace it with a new one. Answer A. Immediately report the issue and request a replacement container. Explanation. OSHA, Occupational Safety and Health Administration, requires proper disposal of biohazardous materials to prevent exposure to bloodborne pathogens. Option B is incorrect because ignoring the issue increases risk of needle stick injuries. Option C is incorrect because pushing sharps down can result in accidental injuries. Option D is incorrect because sharps must be disposed of in designated containers, not regular trash. Best practice: ensure all staff follow OSHA safety protocols and report hazards immediately. Question 20, topic: medical office procedures and workflow optimization. A medical administrative assistant is responsible for streamlining patient check-in and check-out procedures. The clinic has received several complaints from patients regarding long wait times at the front desk. Which of the following strategies would be the most effective in improving workflow efficiency? A. Implement a self-service kiosk or online check-in system for patients. B. Schedule all patients at the same time to reduce idle periods between appointments. C. Eliminate appointment confirmations to save time on administrative tasks. D. Reduce the number of front desk staff to lower operational costs. Answer A. Implement a self-service kiosk or online check-in system for patients. Explanation. Using self-service kiosks or online check-in options allows patients to complete forms, update insurance details, and verify demographic information before arriving at the clinic. This reduces wait times and improves efficiency. Option B is incorrect because scheduling all patients at the same time creates bottlenecks and inefficiencies. Option C is incorrect because eliminating appointment confirmations increases no-show rates. Option D is incorrect because reducing front desk staff may increase delays rather than improve efficiency. Best practice: use automated check-in systems and optimize scheduling to enhance patient flow. Question 21, scenario-based. Topic: HIPAA compliance and handling confidential information. During a busy afternoon, a medical administrative assistant accidentally faxes a patient's lab results to the wrong number. The office immediately realizes the mistake. What is the most appropriate next step? A. Contact the unintended recipient and request that they destroy the fax. B. Ignore the mistake since it was an accident and unlikely to cause harm. C. Resend the fax to the correct number and delete any record of the incorrect transmission. D. Report the incident to the office compliance officer and document corrective actions. Answer. D. Report the incident to the office compliance officer and document corrective actions. Explanation. Under HIPAA regulations, any unauthorized disclosure of protected health information must be documented, and appropriate corrective measures should be taken. Option is incorrect because contacting the recipient is not sufficient without proper documentation and follow-up. Option B is incorrect because ignoring the mistake violates HIPAA compliance. Option C is incorrect because deleting records of the incorrect transmission could be considered intentional misconduct. Best practice: always verify recipient details before sending confidential documents. Question 22, topic: medical billing and coding compliance. A medical administrative assistant is reviewing billing claims before submission. They notice that the provider has selected a Level 5 Evaluation and Management M Code for a simple 15-minute consultation. What is the most appropriate action? A. Verify the documentation to ensure the code matches the complexity of the visit. B. Submit the claim as is to avoid delaying reimbursement. C. Change the code to a lower level without consulting the provider. D. Delete the claim to prevent a potential insurance audit. Answer A. Verify the documentation to ensure the code matches the complexity of the visit. Explanation. Upcoding, billing for a more complex service than provided is considered fraudulent billing and can lead to legal penalties. The assistant should check the provider's documentation and consult them if necessary. Option B is incorrect because submitting an incorrect claim can trigger audits or fines. Option C is incorrect because only the provider can modify coding decisions. Option D is incorrect because deleting claim without proper review is not an appropriate solution. Best practice: use coding compliance software to flag potential errors before submission. Question 23, scenario-based. Topic: telephone etiquette and patient communication. A patient calls the clinic frustrated that their prescription refill request has not been processed for 3 days. They demand immediate assistance. What is the most appropriate response? A. Apologize for the delay, verify their request, and follow up with the prescribing physician. B. Tell the patient to contact the pharmacy instead, as it is their responsibility. C. Inform the patient that prescription requests can take up to a week and refuse to escalate the issue. D. Hang up if the patient becomes rude or impatient. Answer A. Apologize for the delay, verify their request, and follow up with the prescribing physician. Explanation. Effective patient communication requires empathy, problem solving, and follow through. Ensuring that the refill request reaches the provider promptly helps resolve the issue. Option B is incorrect because pharmacies cannot process prescriptions without provider authorization. Option C is incorrect because delayed prescription processing can negatively impact patient health. Option D is incorrect because abruptly ending calls damages patient trust. Best practice: establish clear procedures for prescription refill requests to prevent delays. Question 24, topic: medical ethics and patient advocacy. A patient refuses to sign a Notice of Privacy Practice (NPP) form during check-in. They insist that they do not want their medical information shared under any circumstances. What should the medical administrative assistant do? A. Document the refusal in the patient's record and proceed with their appointment. B. Refuse to let the patient see the provider until they sign the form. C. Have the patient sign waiver acknowledging they are opting out of HIPAA protections. D. Alter the form to indicate the patient has accepted the terms. Answer A. Document the refusal in the patient's record and proceed with their appointment. Explanation. Under HIPAA regulations, patients have the right to refuse signing the NPP. However, the clinic must document the refusal for compliance purposes. Option B is incorrect because patients cannot be denied care for refusing to sign. Option C is incorrect because HIPAA applies regardless of patient's signature. Option D is incorrect because falsifying documents is unethical and illegal. Best practice. Clearly explain patient rights and privacy protections. Question 25. Scenario-based. Topic: emergency preparedness in a medical office. During a routine work day, the medical office experiences a fire alarm activation. The medical administrative assistant is responsible for guiding patients and staff to safety. What should they do first? A. Calmly direct patients and staff to the nearest emergency exit following the evacuation plan. B. Call 911 and wait for instructions before evacuating. C. Turn off all computers and lock the front office before leaving. D. Attempt to determine whether the alarm is a false alarm before acting. Answer A. Calmly direct patients and staff to the nearest emergency exit following the evacuation plan. Explanation. Fire safety protocols require immediate evacuation following the clinic's emergency plan. Safety is the top priority. Option B is incorrect because calling 911 should be done after evacuation begins, not before. Option C is incorrect because securing office equipment is not priority during an emergency. Option D is incorrect because waiting to confirm if it's false alarm delays evacuation and increases risk. Best practice. Conduct regular emergency drills to ensure staff know how to respond quickly. Question 26. Scenario-based. Topic: patient scheduling and conflict resolution. A busy medical office is experiencing double-booked appointments due to a scheduling error. Two patients arrive at the same time, both claiming they have confirmed appointments. One patient is visibly frustrated, while the other appears understanding but worried about their schedule. What should the medical administrative assistant do first? A. Calmly acknowledge the issue, apologize, and check with the provider to determine the best solution. B. Tell both patients to sort it out among themselves and take a number like at the deli. C. Secretly reschedule one patient without telling them and hope they don't notice. D. Blame the scheduling software and insist that nothing can be done. Answer A. Calmly acknowledge the issue, apologize, and check with the provider to determine the best solution. Explanation. A proactive and empathetic approach is necessary when handling scheduling conflicts. By acknowledging the issue, apologizing, and consulting the provider, the assistant can find the best way to accommodate both patients. Option B is incorrect because medical offices are not self-service buffets where patients duke it out for love. Option C is incorrect because sneaky rescheduling will likely backfire, leading to more complaints. Option D is incorrect because passing blame does not solve the issue. Patients expect solutions, not excuses. Best practice: always double-check schedules and a backup plan for scheduling conflicts. Question 27. Topic: insurance verification and medical billing. A patient arrives for an appointment but presents an expired insurance card. They insist their coverage is still active and demand to be seen immediately. What is the most appropriate course of action for the medical administrative assistant? A. Politely inform the patient that verification is required before proceeding and contact the insurance provider. B. Assume they're telling the truth and process the visit as covered under their expired policy. C. Refuse to see the patient unless they pay for the visit upfront in cash. D. Let them see the doctor first and worry about billing later because money is just concept. Answer A. Politely inform the patient that verification is required before proceeding and contact the insurance provider. Explanation. Verifying active insurance coverage is essential to avoid billing complications and denied claims. If insurance is expired, the patient may be responsible for payment. Option B is incorrect because assuming active coverage without verification can lead to unpaid claims. Option C is incorrect because requiring immediate cash payment without alternatives may violate office policies. Option D is incorrect because, while existentially interesting, billing is still very real to healthcare providers. Best practice: check insurance details before appointments and offer payment plan options when needed. Question 28. Scenario-based. Topic: medical records and patient confidentiality. A long-time patient calls the office requesting a copy of their medical records. However, they are unable to come in person and ask for the records to be sent via email. The medical administrative assistant knows that medical records contain sensitive, protected health information. 5. What is the best course of action? A. Inform the patient that medical records can only be released through secure HIPAA-compliant methods and offer secure fax or patient portal access. B. Attach the full records to a regular email and send them immediately to avoid delays. C. Tell the patient that medical records cannot be released under any circumstances. D. Screenshot the records on a personal phone and text them to the patient as a favor. Answer A. Inform the patient that medical records can only be released through secure HIPAA-compliant methods and offer secure fax or patient portal access. Explanation. Under HIPAA regulations, FI must be transmitted securely. Most clinics provide records through secure patient portals, encrypted emails, or fax. Option B is incorrect because email is not inherently secure and could expose sensitive information. Option C is incorrect because patients have the right to access their own medical records. Option D is incorrect because texting private medical records is wildly inappropriate, even if it makes things easier. Best practice, always use secure channels for medical records and verify patient identity before release. Question 29. Topic: Medical office emergency response. During a patient visit, an elderly patient suddenly becomes unresponsive in the waiting area. What should the medical administrative assistant do first? A. Call for emergency medical assistance 911 and alert the medical staff immediately. B. Attempt to diagnose the patient and suggest over-the-counter medication. C. Move the patient to an exam room without informing anyone. D. Calmly continue checking in other patients and assume someone else will handle it. Answer A. Call for emergency medical assistance 911 and alert the medical staff immediately. Explanation. In medical emergencies, the first priority is to call 911 and alert on-site medical staff. Delaying assistance can be life-threatening. Option B is incorrect because medical administrative assistants are not licensed to diagnose or prescribe. Option C is incorrect because moving an unconscious patient without medical guidance can be dangerous. Option D is incorrect because ignoring an emergency is negligent and unethical. Best practice. All staff should be trained in emergency response protocols to ensure patient safety. Question 30. Scenario-based. Topic: Conflict resolution with difficult patients. A patient storms into the office angry that they were billed for a service they believe was covered by insurance. They demand an immediate refund and threaten to leave a bad review online. How should the medical administrative assistant respond? A. Remain calm, review the bill with the patient and offer to contact their insurance provider for clarification. B. Argue with the patient and insist the office is not responsible for their misunderstanding. C. Immediately refund the patient to avoid confrontation regardless of policy. D. Tell them that bad reviews don't matter because true excellence doesn't need validation. And so A. Remain calm, review the bill with the patient and offer to contact their insurance provider for clarification. Explanation. Patients may misunderstand insurance coverage and billing. Providing clear, professional assistance can resolve disputes and maintain patient trust. Option B is incorrect because arguing escalates conflict and damages patient relationships. Option C is incorrect because automatic refunds without verification could lead to fraudulent requests. Option D is incorrect because what poetic businesses do, in fact, care about reviews. Best practice. Use clear explanations and assist patients with insurance claims to prevent disputes.